Hi, my name's Dr. Beth Hartog, and I'm a reproductive endocrinology and fertility specialist, and I'm affiliated with Riverview Medical Center and Meridian Momtourage. And I just want to tell you a little bit about something called recurrent pregnancy loss. We use the term RPL. Recurrent pregnancy loss is something that I have a lot of patients come to see me about, and we give somebody that diagnosis or that name when they've had 2 or more miscarriages. And it's a devastating thing. It's not something that anybody wants to experience. People who have 2 pregnancy losses feel they're never going to have a term pregnancy and feel hopeless. So we like people to get to the doctor as soon as they can when they're experiencing a situation like that and be evaluated. There's lots of things that we can check out, and there's lots of things we can do to help. I think people think the opposite. They think that, if I've lost the pregnancy twice, I'll never be able to do it. So some of the things that we look for, and it all can be accomplished pretty simply, just lots of tubes of blood and one evaluation of your uterus with a special ultrasound machine, special ultrasound test with fluid in your uterus, or an x-ray called a hysterosalpingogram. And what we look for are things wrong with the uterus, abnormal shape, fibroids, polyps, things that can grow or acquire over time. And all these things can be surgically corrected. Another category of things we look for are hormone imbalances, and we can fix these hormone imbalances quite simply with certain medications to put the hormones back in balance. We find that with thyroid disorders, prolactin problems, and something called polycystic ovary syndrome, which is quite common in the population. 6 to 8% of women have that. And that's an imbalance with excess male hormone we call androgens. And again, all these hormone things can be quite simply fixed with other medications to fix it and have a good outcome with another pregnancy. A third category of things we look for is genetic disorders. It can be a congenital or acquired, and we can help in that situation first diagnose the problem with a blood test, and then there's things that we can do. We can genetically screen embryos during an in vitro fertilization or IVF process, and we can also screen embryos for chromosomal abnormalities that can happen due to errors at the time of conception. So these can be congenital, as I said, somebody could pass it, mom and dad could pass it down to a baby, or just acquired where aging process causes the embryos or the sperm and egg just not to fertilize properly, and therefore genetic problems. But we can screen for these things and help to have a normal outcome next time. Another category is immune system dysfunction, and we see that in the area of the thyroid gland. We can have antibodies in response to thyroid abnormalities, and what can happen is if we can diagnose that with a blood test and again treat it with a simple medication to have a better outcome. In another immune system situation, celiac disease is a disorder where the body doesn't recognize their own tissues properly, and you can get damage to the intestines, and this damage to the intestines can result in failed pregnancy. Going on a gluten-free diet, which is no wheat, rye, or barley, for a specified amount of time can have a normal outcome in another term pregnancy. So these are some of the things that last category I might as well mention, I missed one. The 5th category would be blood clotting disorders. And so a panel of tests can be done to look for abnormal blood tests that would give you a diagnosis of blood clotting disorder. Blood thinners can be used. We can help that couple have a term pregnancy. Of all those 5 categories of things that we check for, 50% of the time we're going to find a problem, 50% of the time we don't, and we call that unexplained recurrent pregnancy loss. In that situation, what we do is there's things we still can do, even though it's unexplained. We can help with progesterone support, which is a kind of a pro-pregnancy hormone. We don't have definitive data to say it helps, but we know it doesn't hurt, and so that is something that we consider using. We use something called gonadotropins, which are injectable fertility drugs, and those can help with making the lining more lush, more receptive, have a better quality implantation, if you will, and more chance potentially of a term pregnancy. Also, if things fail, we can consider using donor eggs, which is using another woman's eggs to help still get to have your own pregnancy, your own baby, and genetically still your partner's offspring. So there's lots of things we can do in the situation of recurrent pregnancy loss, and so we encourage people to get here early on. If you've experienced 2 losses, call, find out about it, and we can help evaluate and treat the situation. And also, it's not a bad idea to get some help from a counselor, because this is a stressful process, and you want to get support, where you need it.